I'm going to be the nurse that will complete your assessment today. I see that you're here today because of feelings of sadness. Can you tell me more about that?
Yeah, my health is just declining and less manageable, and I feel so inadequate.
Okay. Tell me more about what you mean by inadequate.
I can't do the things I once enjoyed, and I quit doing the things that made me happy.
Okay. So I hear you say that you have feelings of sadness because of changes in your health. You want to feel better and get back to normal activities, and that's why you're here today. Is that correct?
Yes.
Okay. Is it okay with you if I get started with the exam?
Yes, that's fine.
Okay. Can you state your full name?
Ellen Renee Goff.
Okay. And Mrs. Goff, how do you prefer to be acknowledged? Do you want me to call you Mrs. Goff, or is Ellen okay?
Ellen is fine.
Okay. Do you know where you are at this moment?
Yep, 17 Lincoln Road, Rockville, Indiana.
Okay. Do you know what doctor's office you're at?
Dr. Smith's.
Okay. And can you state the month, day, and year?
Friday, February 3rd, 2017.
Okay, that's great. Thank you. It appears that when you came into the exam room today that you did not have any difficulty walking. Have you had any falls or falls with injuries over the past year?
No.
You have had a recent weight gain that was noticed on today's measurements for your height and weight. Tell me more about your weight.
Just the reason is limited activity and lack of interest has led me to make very poor food choices.
Okay. So you're feeling disengaged. You're reporting that you're making poor nutritional choices and just a lack of interest in things that may have once been pleasurable to you. Is that right?
Yes.
Well, today your blood pressure is within normal limits. I do understand that you have a history of high blood pressure known as hypertension. Do you feel that your blood pressure has been adequately controlled?
Yes.
Okay. I'm going to start in with the physical portion of the assessment, and I'm going to start by looking at your head. Do you have any problems with headaches?
No.
Okay. Do you ever have problems of dizziness?
No.
Do you have any motions of spinning, ever feeling like you're spinning?
No.
Okay. I'm going to take a look at your ears. I'm going to look in your ears. Do you ever have pain or discharge from your ears?
No.
Okay. Do you ever have neck pain?
No.
Okay. Do you have any recent hearing loss? Any trouble hearing?
No.
Okay. When was the last time that you had your vision checked?
About 6 months ago.
Okay. And did they tell you that they tested you for glaucoma?
Yes.
Okay. And was that positive for glaucoma or negative?
Negative.
Okay, so no glaucoma. Have you had any changes with driving as far as it relates to your vision?
No.
Okay. I'm going to take a look in your nose if you'll tip back. Okay. Have you had any overall changes with taste or vision or hearing?
No.
Okay. So no problems experiencing the food that you're tasting?
No.
Do you ever experience dry mouth?
No.
Okay. Sometimes medications can do that, so it's nice that you don't have that issue. Do you have dentures? Did I notice dentures when I did your...
Yes.
Okay. I'm going to have you open your mouth. Can you stick out your tongue? Can you say ah? Ah. Okay. All right. And it seems like your dentures are properly fitting.
Yes.
Do you have any trouble swallowing?
No.
Okay. I'm going to just check your arms here. And when I touch your arms, do you feel the same sensation, and can you describe it?
Yes, it feels the same, and it's just a pushing.
Okay, great. Can you grab my hands and squeeze? All right, thank you very much. Can you clench your teeth? Okay, can you open? All right, and close. All right, I'm going to check your reflexes. I'm going to have you sit as you are, and I'm going to tap your leg. Okay? All right, perfect. Do you experience any pain or tightness in your chest?
No.
Have you ever experienced that in your chest?
No.
Okay. Now listen to your heart. Just breathe normal. Deep breath. Deep breath. Deep breath. Deep breath. And again with a deep breath. Deep breath. Have you ever been a tobacco user?
No.
Okay, and you don't presently use tobacco?
No.
Okay. Tell me about the usual amount of physical activity that you get.
I just get very little because of the sore on my foot.
Okay, and I'm gonna take a look at the sore on your foot. Do you feel like you tire easily?
Sometimes.
Okay, and I would like to be sensitive to that today during the examination. Do you feel strong enough to continue with today's exam?
Yes.
Okay. I would like for you, as I assess your stomach, if you can, go ahead and lay down. Do you have any unusual pain or discomfort in your stomach?
No.
And if you don't mind, go ahead and sit back up. Would you like some help? Do you have any troubles with constipation?
No.
Okay. I have reviewed your medication list today, and some of the medications that you take can contribute to constipation, and also the question I asked about dry mouth. So just wanted to make sure that you weren't having any problems there. Tell me a little bit about your home situation. How do you get groceries? How do you get the foods that you need?
My husband and I still drive. We usually share that task.
Okay. And who prepares the home meals that you have?
Usually me.
Okay. So you live with your husband.
Mm-hmm.
And I am aware that you have children and a grandson.
Mm-hmm.
Okay, but they don't live with you.
Correct.
Okay. Do you know what you had to eat today?
Yeah, for breakfast I had oatmeal and a banana, and then for lunch it was pizza.
Okay. All right. When we think about constipation, you say that that's not a problem for you, but how often would you report your bowels moving?
I would say daily.
Okay. I'm going to take a look here at your lower legs. Right now I'm checking your pulses, I'm checking for circulation. With your history of diabetes and the peripheral vascular disease that you have, it decreases circulation and decreases your wound healing. Looking at this wound on your right heel, tell me a little bit more about that.
It was just something that I started to develop.
Okay. Do you remember how it started?
No.
Okay. How has having this wound affected your life?
I just feel like that I'm not as mobile as I once was.
Okay.
I feel like a failure.
Okay. So it sounds like having this wound is really affecting your healing.
Yes.
Okay. And I noticed that you have another discoloration here to your left great toe. Do you know? Can you tell me anything about that?
I don't know anything on that.
Okay. Do you use any mobility aids for ambulation?
No.
Okay. I noticed that you did not come in with any today. Let's talk about do you have any vaginal itching, discharge, or pain?
No.
Okay. Do you experience a loss of urine when you cough or sneeze?
No.
Okay. And if you don't mind sharing with me, are you and your husband sexually intimate?
No, but we share affection with each other. That's about it.
Okay. So you do feel loved by your husband. Again, I want to be sensitive to you tiring easily. Is it still okay to continue with the assessment?
Yes.
Okay. Are you basically satisfied with your life at the present time?
Yes. Well, I say yes, but not really. I do feel sad a lot of times.
Okay. And that's the reason that you're here today, is because of those feelings of sadness. So let's talk a little bit further. Have you dropped activities and interests that once were pleasurable to you?
Yeah, I used to enjoy working in church.
Okay.
And I was forced into retirement, and I haven't been back to the church in the last 12 months.
Okay. So you've had a lot of life changes. Sounds like work had been very important to you. Church was also very important to you, but you've since isolated yourself from church and really kind of withdrawn because of that forced retirement.
Yes.
Okay. Does this make you feel like your life is empty?
Yeah, I just feel like I can't do what I used to be able to do.
Okay. So are there feelings of worthlessness in your current state?
Yeah, because I can't take care of myself without feeling like I have to depend on others.
Okay. And that feeling of depending on others is a lot different for you. You're used to being the caretaker and the one where others depended on you.
Yes.
Okay. Are you in good spirits most of the time?
I try to be, but since retirement I've suffered from severe depression.
Okay. I do notice that you appear sad today. Your affect is a little bit flat and there's a little less eye contact, so I have noticed that. And I think that a lot of these things that you've isolated yourself from are opportunities for healing. Let's continue on about your family support. Do you feel like your family supports you?
Yes, and I love my family. I have a loving husband with 50 years of marriage and 2 daughters and 1 grandson.
Okay. Do you have a network of family and friends?
I had a social network of friends at work, but I don't have contact with them since retirement. My church family and friends have always been very important, but I quit going over the last 12 months, so I've lost contact.
Okay. So again, that separation from church and that retirement from work come up. You might consider an opportunity to reach out to previous employees that you worked with, and then we'll talk about the opportunities for you to get engaged with church again. How often do you have contact with family and or friends?
Well, I see my husband daily and my children at least weekly. I'd love to see my grandson more than every couple of months. I've had some visits by the home health care nurse twice a week, and I really enjoy my time with her. She reminds me a lot of my own daughters.
Okay. So it sounds like that you're the home health nurse, even though you feel dependent upon them and your family, you do get some pleasure of having that individual come as a reminder a lot of your daughters.
Yes.
Do the individuals that you have contact with, do they make you feel loved?
I have never felt anything but love from everyone in my life.
Okay. So you value the relationships that you have with these individuals.
Yes.
Can you count on them if you were in need of assistance?
I can count on all my family and friends for support. My husband has failing health, so I often worry about him more than my own needs. I've been admitted to the hospital several times this year due to complications with my diabetes, though.
Okay. So even having the family and friends as support, there's been concerns about the mismanagement of your diabetes and having these episodes of readmissions or admissions to the hospital, which are concerning for you.
Yes.
Okay. Do you consider yourself to be a spiritual person?
Yes.
And how does that spirituality relate to your health and healthcare decisions?
Well, I know that my Christian faith and my past experiences have always influenced me with helping me make the right healthcare decisions. Plus, I know I need my minister and members of the church for their support.
Okay. So it's really important for you to have that spirituality in your life, is what I'm hearing you say.
Yes.
Okay. Well, Ellen, you are here today because of your reported feelings of sadness. I have been able to consult with your provider the findings from today's assessment. Dr. Smith and I have come up with a plan for you that's beyond traditional treatment of using medications. I know that this is a difficult time for you, and I empathize with you. The withdrawal from pleasurable activities, spiritual loneliness, and changes in your perception and emotion can really impact healing. So what I'd first like to recommend is that you see a nutritionist or a registered dietitian. This is a covered service by your insurance, which is Medicare. If you don't feel ready for this type of consultation, maybe you consider efforts to improve dietary habits for better control of your blood sugars on your own or with the support of your family. I have some tools and resources that I think will provide you helpful information. I will share those with you before you leave today's visit. You may also consider just modifications with your diet or habits on a small scale. Utilizing your family and friends and goals for success will keep you successful. Next, your religious affiliation has always been very important to you. I understand that you have withdrawn from the organization and people over the past 12 months. You should consider returning. Maybe you decide to talk to a church friend or the minister first. There are also opportunities to view the sermon from church recordings if you are not fully ready to return. And along those same lines, maybe you consider at least 5 minutes of daily prayer. Maybe you consider a quiet space asking your family for this time to promote healing. This is all important to you and your healing. I would like to follow your progress. I will schedule another visit with you in 2 weeks. I would also like to call you in a couple of days. Is this okay?
Yes.
Okay. Thank you for your visit today, and please call the office and let us know if you need anything else.
Thank you.
Thank you.